All right, so we're going to show you how to feed through an esophagostomy tube or an E-tube feeding tube. So pretty much what this is it's a catheter that's inserted into the neck, into a small incision that goes directly into the esophagus. So pets will go home with this, owners will do this at home. We'll have the wrap right around the neck just to kind of keep the feeding tube in place so it doesn't slip around. It's sutured into the neck, and then the part comes out here that you're going to feed through. So before you're ready, you just want to make sure you have all of your supplies. So I have the water that I'm going to flush with. You want to make sure that that's room temperature. Don't want it to be too hot or it can burn the esophagus. We don't want it to be too cold or it can be uncomfortable. And then I have 2 examples of food. So pretty much this is what you want your consistency to be like. It's pretty much liquid. It's going to slide into the tube really easily. If there's any sort of chunks in it at all, like this one, if it's not totally liquid, then it's going to clog up your tube. So you definitely want to make sure that it's nice and liquid. So you can go home with 1 of 2 syringes, just depending upon how much per feeding you have to do. Your doctor will send you home with a syringe that makes sense for the amount per feeding. So this one holds a maximum of 20 milliliters. You can see the 20 all the way down there. And then it goes in 5 milliliter intervals for the large lines. And then the middle lines in between the large lines are 1 milliliter each. So for example, if we're drawing up to 15, that's easy. We're going to draw right up to the 15 line here. If they want you to do something odd like 18, you're going to go up to the 15 and then go 3 down. So 15, 16, 17, 18. So right up to that line there. Same thing with your larger syringes. So if you have maybe a larger pet that needs more per feeding, they may send you home with a larger syringe. So this one holds a maximum of 35 milliliters. Again, same thing. So the large lines go into intervals of 5 milliliters and the smaller lines are 1 milliliter in between. So if they want you to drop 25, again, pretty easy, right up to the thick line with the 25 on it. If they want you to do something like 32, you can draw it up to your 30 and then go down 2. So 1, 2. So your 32 would be the second line down from the 30. So when you get your syringe, it's probably going to be in a plastic casing like this. It just means it's pretty clean, it's sterile. We haven't used it yet. So to open up the syringe casing, you're going to want to take this end here and twist it so that it pops. This bottom part will come off, and then you can just take your syringe right out. So when you draw up your food that you have, as long as you've mixed it well beforehand, it's going to be easy to draw up into your syringe. So I have my liquefied food here. I'll draw it right up to 10 just for demonstration purposes. So you're going to stick the bevel into the food here, and you're just going to draw right up. If you get some air in it, that's okay. You're just going to keep drawing up. So where we have the air in it, we're just going to flip it back so the air bubble goes up to the top. And then we're just going to push up so that the air comes out. So when you get a little bit of food there, that's how you know the air is out. So we want a little bit over 10, so we can put some more back in there, right up to your 10 milliliters. It's always helpful to have a paper towel on hand just so you can wipe around the top so you don't get it on your hands, but just making sure that you're going up to the correct measurement and making sure that your food is the correct consistency. So when you're getting ready to feed your pet, you want to make sure that they're not laying like this. You want to make sure that they're sternal so that they are sitting upwards. Best case scenario, if you can get them to sit so that their head is higher than the rest of their body, it'll just help the food flow from the esophagus into the stomach a little bit easier. He is fake, so he's going to lay on his side for this demonstration. So you want to make sure you have all of your supplies with you before you start. It's just going to make it easier so then you don't have to stop the feeding, go and get more supplies, come back. It's just going to make everything flow a lot easier. So first and foremost, your tube is going to come with what we call a Christmas tree attachment on the end, which is this blue part here. It just makes it easier for the syringe to attach. And then this is the plug on the end. So when you're ready to do your feeding, you're just going to twist off this plug, and you can see the little attachment at the end there. That's right where your syringe is going to go. So I'm going to take my syringe of food, twist it right on there, and when you twist it on correctly, you can pull it, it's not going to come off. The biggest thing with syringe feeding through an E-tube is to go slow. So your whole feeding, whatever amount your vet has instructed you, should take 15 to 20 minutes, sometimes more, depending on how your pet's reacting. So if you notice any lip smacking, hard swallowing, anything like that, just make sure you're going a little bit slower so as not to cause nausea and vomiting. So we're just going to start injecting here, nice and slow. You can do small amounts at a time to make sure everything's going fine. If your pet seems comfortable, then everything is going okay. If you notice any discomfort or anything like that, then you can stop and reevaluate. So you're just going to inject very slowly until you finish your full feeding. This is going a little bit quicker than you would at home just because it's a small amount. Once you're all the way down to the bottom of your feeding, you can switch out your syringe. So I'm going to take my syringe of water. You're going to flush it with water to make sure that no food stays in the line and clogs it up. So same thing as we took the plug off. We're just going to hold on to the Christmas tree, twist off the food syringe, attach the water syringe the same way, and you're just going to flush that whole thing in there just to make sure that no water remains in the syringe or in the tube. Once you're finished, you can have your plug handy. So we're just going to detach the syringe the same way as we did with the other one. Just twist it right off. We're going to take our plug, and that twists on the same exact way. So put it on and twist. If you pull on it and it doesn't come off, it's attached correctly. So if you are in the middle of your feeding and you encounter some resistance, you're not able to push any more of the food in, your feeding tube may be clogged. So there's a couple of things you can do to try and get it unclogged. Easiest is just to pull back on your syringe and see if you get anything back. That may be enough to dislodge the clot that's in the tube that's preventing anything else from going through. Another thing, it's always helpful to have an extra syringe of water handy, because then you can disconnect the syringe with the food, attach it with water, and see if you can flush it through with the water, like so that it's flowing again. If it gets stuck, one of two things could be going on. There could be food that's left over from your previous feeding, so you always want to make sure once you're done with your feeding to flush the line through with water. Another common mistake is people don't use a blender to get their food nice and liquidy in consistency, so kind of like this. You want to make sure there's not a lot of chunks in it. That's going to clog up your tube very, very easily, especially if you have a small pet with a small tube. So try those two things. If after that you're still not able to get water down, you're still not able to get food down, you've tried all the tricks, your food's nice and blenderized, then call your vet and they'll be able to come up with other suggestions to help you troubleshoot.